Dr. John Mullins. We're back at Marshall Lifestyle Medicine live in the middle of a smart lipo procedure. We just completed phase 2, which involves taking the laser and going through and dissolving the fat, and then also superheating the underside of the skin to allow it to tighten up once we're completed. And we're getting ready to start the actual procedure where we do the body sculpting. This is the part that actually the patient will see any results from. This is where we remove the fat and try to sculpt it in such a way that we get the best possible aesthetic result. And so I'm going to be doing some of this while I'm answering some questions. I think there were some questions that came in during our last broadcast. Casey, do you mind?
Someone wanted to know if they were a candidate because they have not lost all the weight they want to, or if they needed to wait until they just needed spot treatment. If you could, what you could do for them.
Sure. Well, the best candidates are always the ones that have the most realistic expectations. And so we have two different types of people come in. Some folks are just trying to be kind of what's called debulked. They don't like the way they fit in their clothes. They tend not to be exactly the overall size that they want to be in general. However, they're really concerned about an area that just doesn't allow their clothes to fit properly. And they have realistic expectations that I'm not going to be able to give them a six-pack per se, but I am going to be able to remove a significant amount of fat, up to 10 pounds worth of fat. And then while we continue to work on the overall weight loss program, and those folks do very, very, very well. The second subset of folks that come in are folks that have diet and exercise most of their whole life, and they have one or two areas that are resistant. No matter what they do, it is still there. People that have had babies, even guys that work out every day, they may have one spot that just does not go away no matter what. And in those cases, I can go in and spot remove those little imperfections. And in general, I can almost give them a six-pack if I want to. I can sculpt it exactly the way I want. It's almost like using a paintbrush. I just go in and just kind of mold it exactly the way I want. And in a lot of ways, what we're doing here is art. Because even though a lot of people may know how to do this procedure, the results are certainly varied depending on the hands that are doing it. So to summarize, we do debulking, which in a lot of times will allow a person to fit better in their clothes and just have better self-esteem while we're working on an overall weight loss program. And then the others, they're already on a weight loss program and they just have a problematic area that has bugged them for years.